in studio with the Admiral Bill Stubblefield.
Rob, let me give a hats off to Ryan Sachs. As superintendent, I think he comes in, he's honest, he's detailed, and he's knowledgeable of the questions. I'm impressed with the interviews. New
York Times best-selling author John Gilstrap.
Good morning.
And via telephone, the Senate Finance Chair Jason Barrett. JB, good morning.
Good morning, gentlemen.
You getting some snow, we heard this morning?
Yeah, about, 2 or 3 inches maybe, just enough to be a nuisance.
Yeah, everything still on time and on schedule there?
Apparently the Kanawha County schools are not, which is, got staff a little upset that has kids, but for all of us in the legislators and everything on schedule, in the Capitol, everything's running on time. So, as on time as the Capitol runs.
Hey, let's talk vaccination bills and such. I know you guys had a lot of discussion about that yesterday. We had Mike Pushkin on in the 8 o'clock segment, and then Bill Kearns in that same segment expressing their concerns over the vaccination laws that were passed, at least got through yesterday. Can you tell us some details about these and where this brings us in comparison to neighboring states?
Well, I generally speaking, I think there are 44 or 45 states that allow some type of religious an exemption. I'm not sure if all those are religious or not, but some type of exemption for children in schools to be exempt from mandatory vaccinations. And so I think this kind of basically gets us in line with what most of the country does. We may be going a little further than some other states, but I think this is about individuals' freedom and the ability to make a decision that's best for that child and their family. So,
can I assume all 4 senators from the local area voted for this bill?
Well, the bill is actually it's on third reading today, but I think it's probably going to get delayed a day or two until Friday. But
were all 4 of you yes votes yesterday?
Well, there were amendments yesterday that were looking at kind of restricting some of the freedom the bill affords to children and parents. So there were several amendments. I think basically that all 4 of us opposed most of those amendments or all of the amendments. I think there may have been a couple of yes votes on something that really was more of a not really. I don't think that amendment really hurt anything. It was just it dealt with the phrase public education. It was language taken from the governor's executive order that stated that every child was entitled to a public education. They just took the word public out. So I don't really think that played any real role in what the bill does.
And you said it may take you further than some states. In what way?
Well, there's a philosophical exemption, so that if it's just that way, you don't have to prove that it's your religious exemption. And for me, I think if we're going to provide exemptions to children, and people say it's their religious belief, I don't think they should have to go prove that to the government, or I don't think we should put them in a position where they need to lie to the state in order to make the decisions best for their family. So, and there's. In the bill currently, there's not a reporting. There was some interest and that was one of the amendments yesterday by some members that wanted this reported annually to the state of the students that opted to not receive the mandatory vaccinations.
Morning, Jason. This is John Gilstrap.
Hey, John.
Is it fair to say, I get lost in some of the language here, is the body of this proposed bill, does it eliminate required vaccinations to go to public schools?
It provides exemptions to those mandatory vaccinations. So they're all, I guess, technically still mandatory. However, you can be exempt from those if you choose.
And those exemptions don't have to be proven.
Medical, religious, or philosophical.
Okay,
no.
so I don't want to is a philosophical. So it's not mandatory. I mean, it's just.
I mean, that's probably sure.
Okay.
Yeah, it's semantics at this point, but sure.
So the amendments that were turned down yesterday, the exemptions to, I've been reading the news reports, and that's where I'm getting lost in the language. So the amendments were so that would mean that certain diseases would have to be vaccinated against?
That was one amendment, yes, that failed overwhelmingly. There was another amendment that said that private schools could have a mandatory policy without honoring an exemption. And that was the First Amendment that I, frankly, expected to be the closest, and it was still, I think, I'm going to use round numbers, 20, 21 or something to 10 or 11, something like that. So it was still soundly defeated as well.
How did this float so quickly to the top? This just seems like an odd first bill of the session.
Well, it was a bill that was vetoed by the previous governor last year. Now, this bill is a little different than that, but the legislature last year passed a vaccine bill that provided for mandates or provided for exemptions, excuse me. And so it's been a priority, and there are a lot of legislators that are passionate about this issue and have been for a number of years. So I think it was, and the current governor, has issued an executive order that to give some exemptions. So I think it's just a priority of a lot of legislators to get this issue behind us and early in the session.
Jason, Bill Cairns was on earlier, and he implied, I don't think he said it specifically, but he implied that this would run counter to the prevailing medical opinion. How much input did you get from the medical community for the discussion of this bill?
The health committee met for several hours the other day, and actually they ran up against their allotted time and delayed the finance committee for a little bit, and then they recessed and came back afterwards. So it was a several-hour meeting the other day. But again, a very similar bill passed last year, where there were hours and hours of testimony from folks on both sides, including medical professionals.
And Dr. Sachs, the superintendent, was on the last segment, and he kept using the word is their commitment to provide a safe environment, safe learning environment. If they have their hands tied by who's exempted and who's required to have vaccination, how are they going to provide this safe learning environment, and will there be money put in by the state to provide extra screening or extra isolation, extra addressing if there should be a rampant outbreak of childhood diseases?
Well, I don't think that we would appropriate money to the school system for isolating children. I think that if someone comes down with a disease like that they would be not attending school, and I think that the basic argument is that if someone is vaccinated and the unvaccinated person becomes ill with a disease that would have been prevented by the vaccine, the vaccinated person's not going to come down with the disease. So I think that
that's not necessarily true,
because diseases mutate.
Yeah.
So I hope you're not operating on that premise, Jason.
Well, I don't think there are too many people with the polio vaccination getting polio at the moment.
There's
no, because there's not an outbreak.
Yeah. Right. Well, and again, there are 40-some states with exemptions. So, I'm not seeing these. I know of a small measles outbreak in Ohio, but you're not seeing these widespread outbreaks. And
well, there's one in West Texas.
In Texas and also New Mexico, fairly substantial.
And New Mexico as well, where they relaxed vaccination policies on religious exemptions, not necessarily philosophical ones, as I understand it. You guys have expanded it to philosophical, too.
Well, and I think a lot of folks and I don't want to accuse people of this, but I think it's reality that there are a lot of people in other states that have used the religious exemption and stated that it was a religious exemption because that is what they have to go through to be able to get an exemption. So I think what we've said is we don't want people to be liars and have to lie to the school or to the government that it is a religious belief when it's really just a philosophical belief, which I think goes on in other states with religious exemptions.
I don't deny that at all.
Do you think this would be an issue if COVID had been handled differently?
I was first elected in 2012. My first two sessions obviously were 13 and 14, and I remember legislators being very passionate in introducing the bills then.
Okay.
Is there more light shined on it because of COVID? Probably a safe assumption.
Jason, several times in this very brief discussion, you have invoked what other states are doing. Is that the primary reason we're doing something, just to keep up with the other states?
No, I think that there is a large contingency of parents across West Virginia that want to exercise their freedom to make their own health decisions for their children, and I think that's what we're allowing them to do. When people act like the sky is going to fall because we passed this bill, that's why I cite what other states are doing, because I don't know of any other state of the 40-some states that have exemptions are now trying to scale that back. I don't know anybody trying to eliminate exemptions. So when people act like this is some wild and crazy policy that we're doing, that's why I cite that other states are doing it and have done it for years.
Is it fair to say that the primary argument in support of this bill is it's none of your business? It's not up to you to tell me what vaccinations to give my kid?
That's individual liberty is, yes. I think that's the primary reason, yes.
And that's we talked earlier about, I can argue both sides of this, and that's the most difficult argument to overcome for me, because I agree with that.
Sure. There are some people who are allergic to vaccines. Some unknowingly, when they get the vaccine, have no idea that they're about to have a bad reaction and are harmed by it. When you talk to health and there's a fund set up federally for, I don't know if it still has money today or not. I have no idea or clue if that's still going to be funded. But that fund is set up specifically for people who have been harmed by vaccines. That does happen. When you talk to health professionals, they will tell you point blank that far more people will be harmed if you don't have a specific vaccination rate in your community. And we talked about the measles outbreaks earlier, and with just a slight drop in the percentage from 95 to 93 can start to trigger something like that. My concern on this one isn't necessarily for the people who don't want their kids vaccinated, but for the people who want their kids vaccinated and can't, because the first vaccination they have a terrible reaction to. So from safety purposes, they don't get the second vaccination, which means they're not fully vaccinated, which means if there's an outbreak, they are susceptible to it. Those people have been operating on the trust of the community to do what's best for the community, and that's how they stay safe. People who are getting chemotherapy, cancer, patients, that sort of thing, where you're much more susceptible to these diseases. Those people all operate on a community trust that we're all doing what's best for the community. When that gets eroded, those people become more susceptible, and that's where my concern is here, Jason. And I understand that is also counterbalanced by the fact that you don't want your children to get a vaccine because of whatever reason. I get that, and that's kind of the delicate balance that society survives on.
It is, and I think it's a valid point. But again, and I think the number that you're referring to is that 96% number, where if 96% of the folks are vaccinated, then that's the kind of safe level. And I fully expect that the vaccination rate in West Virginia holds at 96 or higher. I still think most people are going to be vaccinated. I think that, again, we're just providing exemptions the way many other states have.
Yeah, I'm struck, and I'm going back to a point that John Gilstrap made earlier, trying to tie this mindset change to COVID, and it may have gone back prior to that. But I am really struck by the fact that we have shifted from a mindset that the medical community / the government knows how to best protect us en masse, to the point now that we question their ability to protect, and anything that's suggested, our knee-jerk reaction is to push back against it.
Well, they lied to us.
Well, no, I don't think they lied to us, John. You're talking about during COVID.
Yeah.
There was so much unknown at the time. You could have two choices. You sit back and do absolutely nothing. And we all saw the pictures of the New York where they had these gurneys in the hallway. We saw the same thing in California. There was, when you don't really know all the facts, you act. So when you say they lied to us, I think that is a unfortunate choice of words.
Well, let's get back to Jason here. We only have so much time with them.
Jason, is there a continuum here that this logic could be applied to seatbelt laws, to helmet laws.
Whatever else.
Yeah.
Well, I mean, you mentioned the helmet law, and that has been introduced for a number of years. And frankly, in my opinion, we have a helmet law in West Virginia. And if somebody wanted to repeal the helmet law, I would vote for it, because it's your head and it's your helmet. You decide to wear it, that's up to you. If you don't, you don't.
Seatbelts?
Sure. If you don't want to wear the seatbelt, that's on you. I think children under the age of 18 should be mandatory to wear seatbelts, because they're they're obviously minors, but for individuals to not wear a helmet, that's up to them. Their head, not mine.
What else are you working on in the Senate this week, Jason?
Well, we in Finance Committee, we have budget hearings 4 days a week, where we have different agencies come in, explain to their budget request and their budget appropriation, and the governor's introduced budget bill. So we deal with that. I obviously have a ton of meetings with people all day long about bills, or they're either budget requests or bills that have some kind of financial impact to the state, whether either up or down. One of the issues, the bill that's coming to this committee that just passed the Education Committee the other day, is setting that floor of 1,200, so that any county that has less than 1,200 students the school aid formula will pay them based on 1,200. And I obviously have some concerns with that. Obviously that has an impact to the state's budget, but also we need to. It's 1,200 now, and I had a couple of superintendents in my office the other day, and I just asked them, when does it stop? Is it you set the floor at 1,200 now? When that's not enough money, you want to set the floor in a couple of years somewhere else. So I'm going to try to use this as an opportunity to have some counties that have small student population start the discussion of some consolidation of county school boards.
I think this is a great time for horse trading with those small counties about locality pay. You want your funding for 1,200? You got to give me some locality pay, buddy.
Well, just remember, these counties that have a very small population don't have a lot of members of the legislature either. So
one at a time, though.
We're still working it. We got a couple of different vehicles out there for locality pay, and so we actually have some legislators not from the Eastern Panhandle introducing locality pay bills now. So
cool. Hey, I got a question for you in regards to federal government. When DOGE goes through a department, the cuts are quick and swift. At some point along the way, as they get through the Department of Education, this is going to be affecting West Virginia, especially when they get through Medicaid, and that funding as well is another one that's being looked at for a lot of waste, fraud, and abuse. So you guys are going to have to swiftly pivot when this takes place, because these cuts are immediate. They're not waiting till the end of the year, for instance. Any idea if you guys been discussing how you're going to address that when it does come?
To be honest, I've been so wrapped up in everything going on in this building that I only have so much time in the day. So my focus is on what's going on here. So we'll handle that when we need to.
Final question for Jason, Bill, or John. If not, we'll let him get on with his merry day.
Have a fine, merry day.
All right.
Thanks, Jason. Thank you.
All right, thanks.
Have a good day.
Yep, you too. Bye.
Senate Finance Chairman Jason Barrett.